to curb the spread of the coronavirus disease in Enugu State. As governments at all levels work hard to manage and reduce the spread of the coronavirus disease, Enugu State has taken drastic measures to ensure that the indigenes remain safe and secure. Correspondent Chinenye Mboye, who monitored the level of compliance by residents of Enugu to the directive, reports that they have commended the federal government for the palliatives provided.
Aside air, food is the next most important necessity of life. Hence, the various markets in Enugu may have been closed, but the foodstuff section were allowed. This is Major Market here at Abani Road, Enugu. As you can see, the Easter period is just a few days away, and the market is actually a beehive of activities. Let's talk to one or two of the people we have seen here in the market. Madam, how is the market going?
It's going quite well, but the coronavirus affected everything in this Nigeria. Things are becoming difficult for masses.
Kenyatta Market is closed, but those selling food stuff we are seeing by the roadside, selling various food items. Inside the market, the fumigators were at work. Some men were also seen in compliance to the stay-at-home order, playing draft.
You can see we are playing draft. We are enjoying ourselves together.
This is the food section of Ogbete main market called Akpata. As you can see, the long queue of vehicles over there. These are vehicles carrying wholesale products like tomatoes, onions, carrots, and the rest of them. Unfortunately, the main market is closed. They cannot offload their products. And as such, the middlemen are buying the goods off directly from the trailers and the lorries. A lot of people, some of them are saying the prices are a little bit cheaper because the owners of these goods are afraid that if they remain here for a long time without the markets being opened, the products might spoil.
It's costly. One basket, 10,000.
How much was it before?
Like last 2 weeks, I came here, I bought 4,000.
Now we are there for this place. We are managing to sell our goods, which before we are selling. Before this more than that, but now the thing is selling cheap. But now things don't increase as some of motors they come as they come before.
So how is the price going?
Drastically, there's so much reduction in price. As I'm telling you, to compare other days before the shutdown.
It is expected that the human traffic in these markets will increase as the Easter celebration draws nearer by the weekend. Unfortunately, they are not oblivious of the pandemic, as no one is observing the social distancing.
Thanks a lot, Chinenye. The message here is to cooperate with the government to fight a common enemy, that is the coronavirus. And from Uyo, the capital of Akwa Ibom State, comes a report that socio-economic activities have slowed down due to the effect of the coronavirus disease in the state. Though there are few cases of COVID-19 in the state, government and other institutions have set several strategies to contain the spread. Correspondent Ifeoma Aihoje brings us the situation report in Akwa Ibom.
From January 30, when the outbreak of a virus detected in Wuhan, China, was declared a public health emergency of international concern, the novel coronavirus has dominated the headlines, while governments across the world have continued in the race against time to stop the pandemic. Nigeria is not left out in this fight, as the number of confirmed cases of coronavirus is increasing by the day.
Federal government has come up with an idea that everybody should be isolated for a certain period. They want to know if somebody had the challenge, that sickness, at least the thing will manifest within the period. Then from there, they now know how to handle it.
If you don't lock down and ensure that people tend to reduce interaction as much as possible, to stay in their homes, the tendency is for people that carry this virus to spread it. And besides it being spread by droplets, it's been documented that even people that don't have symptoms can also spread it.
In Akwa Ibom State, the executive arm of government, the legislature, traditional institutions, and civil society organizations have risen to the occasion through heightened sensitization, provision of personal protective materials, screenings at entry points, and regulations to curb the spread of COVID-19 to the state.
In our usual proactive stance, I had weeks ago given the Honorable Commissioner for Health, Dr. Dominic Okpo, the marching order to be on top of the issue, and an infectious disease prevention and control task force was immediately set up. This was even before the first confirmed case of coronavirus in Nigeria was recorded. Creating awareness, through the media, both print and electronic jingles to sensitize the residents with relevant information on COVID-19 infection.
I had to invite Asutan Ekpe, a smaller group of 38 villages, to come and listen to what they have to do to prepare for the coming or non-coming of this deadly disease.
I also encourage them to tell their subjects to embrace the use of hand sanitizers, to also, where necessary, use a face mask.
People in the rural communities don't really have the information about COVID-19 and they think it's not real. So that's why we decided to bring it to their knowledge that COVID-19, this pandemic, the deadly virus, is actually real.
The strategy to avert its spread in Akwa Ibom State has also necessitated novel ways of holding church services.
I commend the church so very much. There is sanitizer here and there, and the spacing in the church is wonderful.
Everybody was supposed to be home, just the production crew to reach people in over 200 homes in the city.
We did whole service in the church. We had what we call church in the house.
It is important that all the instructions issued by the government about safety must be observed.
The stay-at-home directive of government has enjoyed top compliance, while a common sight at most business premises is hand-washing and sanitizing platforms. Worrisome, however, is the alarming increment in the prices of preventive materials and the sad reality that some traders are taking advantage of the current pandemic to extort Nigerians.
Because the cost of a carton of face mask, that carton contains about 2,000 pieces roughly, has skyrocketed from about, I would say 20-something thousand to about 500,000. That's about 2,000% increase. The cost of gloves has moved from, a carton of gloves has moved from about 7,000 to about 40-something thousand.
I usually will sell my normal price. Some women drove in here and bought all my stuff. And they are blaming the pharmacist. I'm sure she's the one that is selling it 10 times the price and making the money. She's not even a pharmacist.
It is therefore the desire of every Nigerian that the commitment and unity of purpose that has come with coronavirus pandemic will be translated to other areas of the economy for national development.
Still to come, efforts by the Federal Capital Territory at containing COVID-19. Join us again after the break.
The coronavirus, also known as COVID-19, has been declared by the World Health Organization as a global pandemic. While clinical trials are ongoing for a vaccine and a possible cure, there is no known treatment for the coronavirus. Nigeria has recorded some of these cases, and people are advised to take these preventive measures to keep themselves safe and contain the further spread of the virus. Wash your hands frequently with soap and water or use hand sanitizers all the time. Maintain social distancing. Avoid touching your eyes, nose, and mouth. Practice respiratory hygiene. If you have fever, cough, and difficulty breathing, seek medical care early. Do not panic. Stop the spread of unconfirmed news. Follow the official government news outlets and report all cases immediately. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
Welcome back to The Correspondents. The coronavirus pandemic has brought about many changes in the socio-economic activity and the lives of the people across the globe, and Nigeria is not left out. Correspondent Hakimat Aliu examines the situation in the nation's capital, Abuja, and efforts by government to curb the spread of the pandemic, with a yearning for palliatives as a way to stay afloat.
Since the outbreak of COVID-19 in the country and its spread to some states, including the Federal Capital Territory, the FCT administration has put up various measures to combat the dreaded virus. These include closing down of schools, massive awareness campaign on ways to guard against contracting the disease, placing a ban on religious and social gatherings, and establishment of isolation and treatment centers for management of COVID-19 patients.
We did not care who was federal, who was state, who was national, who was regional. So we worked with University of Abuja Teaching Hospital, National Hospital, and our FCT hospitals. Now, University of Abuja Teaching Hospital was the first place we had isolation center, and FCT supported them to ensure that the center is fully equipped.
The record of more cases in Abuja led to the conversion of other public and health facilities within the territory to serve as isolation centers.
Our so-called district hospital has been converted to a isolation and treatment center, and this is about 100-bedded hospital. Presently, we are working in Karo Hospital. The whole facility is being converted into isolation and treatment center, and it's about 100 beds. These are what FCT did on its own. Zuba, and there's a facility in Itu. They are all being planned to isolate and treat if the need arises.
To further tackle the global pandemic, the presidential directive on lockdown of the nation's capital has been strongly enforced by a ministerial task team for compliance, while various palliative measures were put in place to cushion the effect of the stay-at-home order.
Staying at home will actually cost some fortunes, because when you are at home doing nothing, certainly you will be doing the eating. I am happy the system they are approaching will certainly go down to the locals, because they are using the traditional rulers within the FCT, and of course these people know their subjects very well. So I believe that if such pattern is followed to the fullest, certainly the palliative will get down to the grassroots. And I want to advise the grassroots to ensure that they go just by the rules.
The COVID-19 pandemic is no doubt one that has affected many sectors of human endeavor, but those mostly believed to have suffered worse hits are low-income earners and those who say their survival depends on daily outings.
I'm taxi driver. That's where my office be that. I have family. If you change now, all this is my family. I know they go farm. So I base for that business.
I'm the only one taking care of the kids. Without me coming outside like that, I cannot be able to take care of the children.
There is nothing for me to maintain myself with at home.
In the midst of all this, the FCT administration is carrying out training and retraining of nurses and health workers in Abuja to ensure proper handling of the situation. The FCT administration has remained committed to investing its human and capital resources in winning this war of combating the spread of COVID-19 pandemic.
Joining us on the program today is Hakimat Aliu, who has been following trends in the Federal Capital Territory. You are welcome to the program.
Thank you so much, Najat. So glad to be here.
Welcome. So as our health correspondent, do you tell the truth? Do you often self-medicate?
No, I don't. I don't.
Well, let's get straight to the heart of the matter.
Okay.
Abuja is now one of the epicenters of the coronavirus pandemic, having been the second state, the second area in Nigeria with the highest number, next to Lagos. So what has it been like covering the emergence of coronavirus in the FCT?
Okay, well, what has it been like? I would say it's been a task for me. But you know, it's dutiful. I have to meet up. We have to meet up with our obligation to give the people right information and right and necessary information as the tradition of the Nigerian Television Authority. So it's duty. I had to go out there to get this information across, had deadlines to meet. Then on the other side, being a human being too, the fear, the worries, it was there, you know. So I had to be at the top of my game, follow the guidelines, protect myself, because I have my families to go back that are worried, like, you're out there covering this, there and here. So I had all that to balance.
Okay, so in essence, what you're saying is you had to follow the guidelines.
Yes, I had to know strictly. I had to follow these guidelines, maintain all the necessary precautions. I had to follow because I'll protect myself. And
now, speaking of guidelines, what has been the level of compliance, considering some residents in the FCT are not finding it easy with some of the directives of the federal government?
I would say low. It's mixed. We have some people complying fully. Then we have the other side. When you go to the suburbs, satellite towns, they were not so cooperative because it wasn't.
From your observation, why is that? Okay. Why those people who aren't cooperating? What do you think, from your observation as our correspondent, is the reason? As you've probably interviewed some of them.
Some of them, yeah. I wouldn't say lack of awareness, because the awareness was there. It's out there. People keep talking about it, but you have people who still believe there's nothing like coronavirus. It's all fake. You still had this set of people that believe it's a big man thing. It's none of our problem. So they had their own, all these misconceptions basically drive their attitude generally towards what they are doing. They just chose to ignore these guidelines because they do not believe.
So, and you know, that which brings me to this question, which is related. People at the grassroots, you know, what is going to be their reception of these guidelines?
Like what I just said now, people who do not believe there's coronavirus, or they say it's not coming to us, it's for the big people. So there's this, it's difficult accepting social distance, like, they can't even meet up with that. Then you know how it is, the setting in our rural areas, the community lives and all that, what they are used to, it's difficult for them to quickly switch to, although it's for our own good, but I think they are finding it difficult to adhere and comply to the guidelines.
But the federal government is working with their community leaders, district heads, to make sure that these messages and guidelines are passed down to the grassroots.
Yes, it's on ground. I know we have meetings. We even cover some of these meetings with the traditional leaders, calling their people that, okay, please do this, do that. But the level, it's not 100%.
But what you're saying is with more education.
Yes, of course. More education. You won't relent now. You keep informing them. They need to know why they have to follow these guidelines. So if you keep telling them, hopefully, I see them cooperating, because everybody wants to stay alive.
So speaking of what's real and not real, with the level, the rate at which patients are being discharged in the FCT, do you think the FCT is winning the war against COVID-19?
I would say yes. I think they've been on the top of their game since the emergence. When we had the first case, it was reported to them. I think the family members called, and they took the man into isolation. But I think it was a critical situation. And then I remember calling the doctor, because I went there. I was in Gwagwalada. We had the patient there, so I tried to ascertain what was on ground. The doctors, I called him over the phone that I'm in Gwagwalada, your facility. I heard there's a patient confirmed with COVID-19. Can you speak to us? Let's find out what's the situation. Like he said, Madam, I cannot. It's between life and death. I need to attend to this man. So we had to. I think they are not taking it lightly. They are on the top of their game, and they are doing well. At least they've discharged a number of patients, and more will be discharged. They are obviously responding to treatments, those that are stable.
All right, then. That's really very encouraging to know. So I want to thank you for being on the program. Thank you for these insights you've offered, and we hope to invite you again soon for more updates.
Thank you so much, Najat. I'm glad to be here too.
Thank you.
Thank you.
And away from COVID-19, erosion is a major natural disaster which has destroyed farmland and other valuables, leaving people along its corridor devastated. Efforts towards addressing this ecological problem and its consequences in Ebonyi State has come to an appreciable state with the intervention of the Nigerian Erosion and Watershed Project. Correspondent Chika Okori reports.
The affected people were gradually picking up through the livelihood activities of the Nigerian Erosion and Watershed Management Project, NUMAP, as they expressed appreciation to the implementers for coming to their aid at a critical time.
We thank NUMAP and the Ebonyi State government for their effort, because this project now have enabled our people, even us, to have oil processing. Since NUMAP has come, we can process more than 20 drums in a day.
The thing has been helping us to train our children. This hiring of chairs make us to extend our business here and there.
Many of us do have anything to eat. But since they came in, we are very, very grateful. Many have changed from poverty, though, you know, you cannot eradicate poverty, but we have reduced poverty in ourselves.
What a NUMAP has actually done for these people is to make sure that we provide alternative livelihood for them. And for the past 3 years now, they've been running those micro activities as cooperative societies, and they've actually been generating income.
Feelings of the people came to the fore when Federal Project Management Unit of NUMAP came on a data validation mission. The team also visited the 7 intervention sites of the project, where appreciable level of civil works were ongoing.
And we want to commend the state government for taking steps in looking forward to the good living of the people of the state, most especially His Excellency, the Governor of Ebonyi State. And then we want to commend him in the area of payment of counterpart fund, which is strictly meant for the payment of this compensation that we interview the beneficiaries of the RAB. We've seen the implementation, and we've seen the level of work in the area of the contractor, which is going well. In terms of the civil work, they are satisfied. In terms of the community interest group, that is the livelihood activities, we visited the sites and we've seen the operationalization of the livelihood activities, which is a kudos. And we really commend the money has been used for the intended purpose.
The state project coordinator, Dr. Philip Echago, assures residents that on completion of the construction works, erosion-related challenges will be a thing of the past.
All the construction works and the associated activities will be completed by December this year. So that is the desire of the project, and we are very hopeful that at the end of the project, that all the ugly experiences of flood that the city used to witness will be a thing of the past.
The tour, however, revealed that the index poverty of the beneficiaries has drastically reduced, even as ecological issues are receiving attention.
Data validation of erosion sites has become more urgent to put an end to the menace. Thanks a lot. That concludes this edition of The Correspondence. Thanks for being a part of it. Let's do it again, same time next week on this station. You can follow the Twitter handle at FUOLUANTA, hashtag NTA Correspondence. Remember to use hashtag NTA Correspondence whenever you make a comment or ask a question. And a quick reminder that COVID-19 is real and spreading fast. Remember to maintain personal hygiene by washing your hands with soap under running water every 20 minutes and abide by the social distancing rule. Stay safe. Bye for now.